Scleroderma is a chronic autoimmune connective tissue disease characterized by the hardening and tightening of the skin and connective tissues. The word scleroderma comes from Greek roots meaning hard skin. It occurs when the immune system mistakenly attacks healthy tissues, leading to excessive production of collagen, a protein that provides structure to skin and organs. While it is considered a rare disease, scleroderma can range from mild skin involvement to severe, life-threatening internal organ damage. Causes and risk factors. The exact cause of scleroderma is unknown, but it is believed to result from a combination of immune system dysfunction, genetic susceptibility, and environmental triggers. The immune system becomes overactive and stimulates fibroblasts to produce too much collagen, which accumulates in tissues. Risk factors include female gender, as women are affected more often than men, and age between 30 and 50 years. Exposure to certain chemicals, infections, or chronic stress may also play a role in triggering the disease in genetically predisposed individuals. Types of scleroderma. Scleroderma is broadly classified into localized scleroderma and systemic scleroderma. Localized scleroderma mainly affects the skin and underlying tissues and does not usually involve internal organs. It includes conditions such as morphea and linear scleroderma. Systemic scleroderma, also known as systemic sclerosis, is more serious and affects not only the skin but also internal organs like the lungs, heart, kidneys, and digestive system. Systemic sclerosis is further divided into limited cutaneous and diffuse cutaneous forms, depending on the extent of skin involvement. Skin and musculoskeletal symptoms. Skin changes are often the first and most visible signs of scleroderma. The skin may become thick, tight, shiny, and less flexible, particularly on the fingers, hands, face, and arms. Patients may experience swelling of fingers, followed by stiffness and reduced movement. Joint pain, muscle weakness, and fatigue are common. Over time, tightening of the skin can limit mobility and affect facial expressions, making daily activities more difficult. Internal organ involvement. In systemic scleroderma, internal organ involvement is a major concern. The digestive system may be affected, leading to acid reflux, difficulty swallowing, bloating, and malabsorption of nutrients. The lungs can develop fibrosis, causing shortness of breath and reduced oxygen exchange. Heart involvement may result in abnormal heart rhythms or heart failure. Kidney complications, though less common, can be severe and may cause sudden high blood pressure and kidney failure if untreated. Raynaud's phenomenon. One of the most common early features of scleroderma is Raynaud's phenomenon, a condition where fingers and toes change color, white, blue, then red, in response to cold or stress. This occurs due to spasms of small blood vessels, reducing blood flow to the extremities. Raynaud's phenomenon can cause pain, numbness, and tingling, and in severe cases may lead to ulcers or tissue damage. Diagnosis. Diagnosing scleroderma can be challenging because symptoms vary widely. Doctors rely on a combination of clinical examination, medical history, blood tests, imaging studies, and sometimes skin biopsy. Blood tests may detect specific autoantibodies associated with scleroderma. Lung function tests, echocardiograms, and imaging scans help assess internal organ involvement. Early diagnosis is important to prevent complications and manage symptoms effectively. Treatment and management. There is no cure for scleroderma, but treatment focuses on managing symptoms, slowing disease progression, and preventing complications. Medications may include immunosuppressants, anti-inflammatory drugs, blood pressure medications, and drugs to improve blood flow. Physical therapy helps maintain joint mobility and skin flexibility. Lifestyle changes such as avoiding cold exposure, quitting smoking, managing stress, and maintaining a balanced diet are essential parts of long-term care. Prognosis and quality of life. The outlook for people with scleroderma varies greatly depending on the type and severity of the disease. Some individuals experience mild symptoms with minimal progression, while others may develop serious organ complications. With early diagnosis, proper medical care, and ongoing monitoring, many patients can lead productive and meaningful lives. Emotional support, patient education, and regular follow-up play a key role in improving quality of life.